Hello, everyone, and welcome to our lecture on Chapter 15, the communication of assessment results. So, we're going to do this whole chapter in one go. It's a pretty short chapter, but also within Chapter 15, I think it's important to keep in mind that the ways that we communicate assessment results are going to vary widely depending on our agency as well as how our assessment comes about. So, communicating assessment results are going to look different if you have a therapy client with whom you are then doing an assessment versus if you have a client who's only coming to you for an assessment. Those communications of findings look different because the settings are different and your relationship with the client is going to be a little bit different. But we're going to talk about it in this chapter here just to give you a little bit more of a breakdown of what those feedback sessions look like after an assessment has been completed. So, the communication of findings within assessment can be considered the last phase of an assessment process. Although it's important to keep in mind that the process of assessment can cycle again as new data is introduced. So you might do an assessment and communicate those findings to a client. And if this is a client that you're seeing in counseling, you might get more information and update your assessment and continue giving that feedback. So it might cycle through multiple times. But in general, the steps of an assessment process are pretty consistent. You're going to do an assessment, or you're going to identify that your client needs an assessment. You're going to select the assessments that that client needs. You're going to administer those assessments. You're going to score and interpret them. And then you're going to communicate the findings for that client. And as a counselor, as counselors communicate assessment findings, it's important to be cognizant of a client's understanding of the assessment as well as the client's reactions to the assessment. In addition, clients or counselors are to identify both the strengths and the weaknesses or opportunities for growth in the assessment findings. So when you are conducting an assessment, you need to make sure that you're communicating the results in a way that the client can understand, whether that be what their actual results are, but it can also include what the purpose of the assessment is. And throughout the assessment process, we need to gauge their reactions, see if things are landing, see what questions they have. A good rule of thumb that I like to take with assessments with clients is that I tell them that the assessment report that I'm going over with them is a living document. So that if something in the document doesn't make sense, or is confusing to them, or they just don't get it at all, I can still make changes to it so that the assessment makes sense for them. And I'm not changing the content. I'm still sharing the exact same content. I'm changing the way that I share that content so that it makes the most sense for the client. And a lot of times clients can feel like the assessment process is all about finding what's wrong with them, which is why it's so vital for us as clinicians to make sure that the assessment includes both their strengths and opportunities for growth so that the client gets the most comprehensive view of themselves as possible. And counselors also need to be cognizant of the counseling relationship process as they communicate findings and plan for the use of the data. By listening attentively and observing the nonverbal behaviors of the client, as well as incorporating cultural information as relevant in the interpretation of the results. A lot of times, and as our book notes, the communication of assessment results can be this balance between art and science. Because as counselors, we have to navigate the science of communicating these assessment results ethically and in the purpose that they were intended, while also being artful in benefiting our clients in the way that's the most helpful to them, adapting to what they need. So oftentimes this communication of assessment results can be this adaptive process for us as counselors. And the literature defines that there are 5 steps to the assessment interpretation interview. And the first of those is to check in with the client. Make sure that you are checking in to see how the client felt on the day of the assessment, the day that it was administered, as well as any reactions the client had to the assessment itself. So typically when you do the communication of findings, you've waited a couple of weeks, or at the very least a couple of days. So you want to check in with the client, like, how have things gone since we wrapped up testing? Did you have any questions? Did you have any reactions? Did you gain any information that's important for me to know to add to this report in the last couple of days? So that check-in piece is important at the start to see what the client's reactions have been so far. The second step involves reviewing the purpose of the assessment and using clear and useful descriptions of each assessment measure that were used and how the client can then understand the results. So, providing a structure for the client to understand the order of this a feedback session, as well as how to understand the assessment report that you're giving to them. Give them a structure so that they understand what you're about to tell them, in providing that structure in a way that they can understand. The third step relates to the counselor and the client looking over the assessment together and reviewing the results. You're going to review the scores and any other assessment data in the clearest and simplest manner possible. So when we're talking about other assessment data, this can include your behavioral observations, potentially if you had contact with any third parties, such as a family member, another clinician that this person is working with. You are going to include all of that information in the review of the results in a clear, simple way so the client knows what this means in their lives. Which leads to the fourth step, the integration of results. And this involves integrating the assessment findings with other information that's known to the client in their life. This will assess the counselor in making the data relevant to the client, as well as providing a more comprehensive interpretation. Oftentimes, and in the report that I'm going to have y'all write for the second half of our time together, this is called the functional impact. It's talking about what the assessment results mean for the client in their daily life. What this means for you as a student, what this means for you as an employee, what this means for you in your relationships with others, in how you take care of yourself, what this means in the functional aspects of your life. And the final stage is the plan for the future, which involves applying the assessment findings in future decisions with the client. This particular section will be largely influenced by the client's information shared during the intake interview when you ask them what they hope to get out of the assessment. Are they hoping to get referrals? Are they hoping to get accommodations at school? Are they wanting you as the assessor to identify specific therapeutic skills that this person should work on that will address what has been bothering them? You're going to ask that question in your developmental interview, in your intake interview, and that is then going to inform your integration of the results in the client's life. Of, okay, here's all these things, here's how it shows up in your life, and here's what you can do with this information moving forward. It's also good practice to have the client at the end of the feedback session to summarize what they remember from the assessment, what you shared with them, and what they have highlighted as the most important pieces of the assessment report that you just went over with them. This is a really good way for you as a counselor to see what's landing for the client and what's not. So if you as the client give you that summary, it really tells you what is the most important to them. And then if you're noticing that they're not summarizing it in a way that was intended based on your summary, you can then pivot and say, okay, I don't think we were on the same page. Let's go back and try that again. Let's see if we can go over this again. There's also possible at times that we need to meet with other interested parties, or what our book calls stakeholders, about a client and relevant assessment data and treatment planning. So sometimes we call this a case conference, where we have other people who are invested in our client's progress that might want to know about the assessment report. This varies depending on the client, but oftentimes if you're working with adolescents, this could include bringing their parents in. It could also include bringing in school personnel, employers, therapists, medication providers. It really varies depending on the client. But we call this a case conference because it's bringing in all of these invested and interested parties who have some amount of interest in the client and how well they're doing. So you want to bring them in so that they know what the results were and how to move forward. As counselors, we need to establish a structure for the case conference and how the stakeholders, those people that are those interested parties that are bringing in, will be involved in the process. And we do this by soliciting information regarding how each stakeholder is involved in the conference, as well as reminding participants of the purpose of the conference to promote client welfare. So it's good practice to have everyone introduce themselves, say how they know the client, what they are hoping to get out of that case conference, and as well as providing a summary for what the assessment was about and why you were engaging in it. Like, what was the primary behavior of concern and what did you do to assess it? As counselors as well, we need to infuse relevant non-test data during the conference. This is where you can bring up the functional impact findings as they relate to each conference member's involvement in the client's life. So if you have someone who's coming in and they're in the client's school system, you're going to talk about the functional impact of the findings in the school setting. You're going to talk about the functional impact of home life with the parents, and so on and so forth. So you're going to tailor the content that you share to the members who are in that case conference. And as counselors, we should always take the quote unquote bad news sandwich approach, where we can layer in information that might be a little bit harder to understand or maybe is a little bit more objectionable with more positive data. So I had a clinician in my master's program who called this the hug, stab, hug approach, where you tell someone something really positive and something that's really good, you stab them with the bad information, and then you hug them again to give them that warmth of like what's going well. And that's the approach that you take with assessment feedback, especially in the case conference approach. You are going to present positive things about the client, things that went well. Then you're going to present the areas for growth, and then you're going to summarize with the positives and where the client can go moving forward in a positive direction. It is always a focus for us to emphasize the strengths of our clients, because it can get really easy in the assessment process to only see the negative. And similar to an assessment that you're doing with other people, at the end of a case conference, it's always good practice to have every member of the case conference to summarize what they discussed and address any remaining questions that they have. See what landed for them, where they want to go moving forward, and to let them know that you are available should they have questions. And counselors should be thorough in the work that they do. And one of the primary areas where we see that thoroughness coming through in the assessment is the assessment report. So the assessment report is what you give to a client after all of the testing has been done that summarizes everything that you did with them. And as counselors, we need to be thorough and intentional as we develop the assessment report, because the written report may be the only part of the assessment process that other people see. So we need to be mindful of that when we're putting content into the report, making sure that it can be interpreted by other people in the context of a client's life, but if the client's not there and they don't have that context, that it makes sense independently. With this intentionality in mind, counselors are to be careful about the unintended consequences of the assessment report for the client and any relevant stakeholders in the client's life. It is always best practice to clearly state the purpose of the assessment report at the very beginning of the report to mitigate any of these unintended consequences. So here's an example of something that I put in one of my recent assessment reports. And this is an exact quote. The purpose of this evaluation was to formally assess the client's neurocognitive status to help with diagnostic clarification and functionality planning. So explicitly stating this is about diagnosis and getting the client the resources that they need to live a functional life given what they have described as neurofunctional concerns. If you put this purpose statement in there, you can start to mitigate some of those unintended consequences of an assessment. And similarly, as counselors, we need to be mindful of the ethical and legal principles as we prepare and share our report with other people. So, for example, if you're giving an assessment report to your client, how are you giving it to them? Are you putting it in a sealed envelope and mailing it? Are you sending it via email? If you're sending it via email, does it need to be encrypted based on your agency's policies as well as legal and ethical guidelines? So making sure that you're staying up to date on those things. And the assessment report should be focused with the purpose of the report clearly stated, as I already mentioned. But depending on the purpose of the report, we might also include supplemental information to the assessment process that might be included. So things like referral sheets for our clients presenting concerns or book referrals. We might incorporate some of those aspects so that they are relevant to the client. And as counselors, we should try to avoid some common problems in report writing. Some of those include poor organization in the structure of our assessment, the use of psychological jargon or unclearly defined terms. This is where I really like to go into the approach of the assessment feedback with my client, as this is still a living document, so that I don't always catch myself when I'm using psychological jargon because it's so second nature to me sometimes. But the client can tell me, like, I don't know what you mean by a Freudian slip. Like, I can say that sort of, I can have the client give me that feedback. You also want to make sure that you're avoiding a lack of integrating information regarding the assessment and other client data. So, in the assessment writing process, sometimes it can just be really easy to just report scores and nothing else. But we really need to have that integrated information of what this means in the client's life so that they can move forward in the best way possible. And finally, counselors should also remember that it's better to write in a report immediately after a counseling and testing session has ended rather than letting a considerable period of time go by. You are going to remember information about your client much closer to testing than you will like weeks later. So it's always better practice to write the report immediately. Though I will tell you that doing the testing tends to be a lot more fun than the writing piece. So it's easy to delay the assessment writing process. So you really have to tell yourself, like, no, I need to get this done because the information is fresh and I need to do this. And also, the assessment report components often vary by the clinical setting. Like, your agency might have a template that they want you to follow, but the common components of an assessment report include a brief description of the client. So they're presenting concerns. This is oftentimes their demographic information at the time of the report, the reason for their counseling or referral, what brings them in for the assessment now, followed by relevant background information about the client, their biographical information, psychosocial history, education history, substance use history, all of those sort of things. Then you'll include a description of the evaluation procedures, so what assessments you used and what the results were, followed up by behavioral observations, how the client was in the context of the work that you were doing in the assessment. Then you're also going to include a report of the assessment results and interpretations, so what these assessments actually mean in the context of the client's life, followed by any recommendations that you have for the client moving forward after you're done with them, and then a brief concluding summary that gives you an opportunity to thank the client for coming in for an assessment and letting them know that they can reach out if they have questions. So again, this is just a general format that often a lot of people follow for their assessment reports, but this could vary depending on the agency and the type of report that you're doing. So that is where we are going to wrap up our discussion on chapter 15. As always, here are the review questions to help you study, and I will see you all in the next lecture.